Chris, it's a pleasure to be with you here today in your beautiful new offices in downtown Philadelphia. Looks great.
Thanks for being here. We're really excited.
Can you start by telling us why you founded NeuroFlow and describe what NeuroFlow does?
My story starts when I was in the Army, served as a captain in the field artillery, deployed overseas as a platoon leader. And to make a long story short, I saw the gaps in healthcare. I had a soldier that struggled with physical health and also mental health, issues with sleep and PTSD, and he didn't get the latter treated. And we lost him to his depression. He took his own life. And the tragedy there is that in hindsight, we found out that he never actually went to go get it treated for, and no one ever followed up to check in on him. And there's a huge gap in care there. And when you zoom out, you realize that's not just a veteran issue, it's a human issue. That happens more times than not. So the question is like, what do we do? How are we actually helping address that problem? So we're a technology platform that partners with health systems and health plans to integrate data analytics, risk stratification, measurement-based care, and care coordination to those appropriate resources, assisting people that otherwise aren't experts, like primary care providers and so forth. And
can you elaborate on why NeuroFlow is important to the healthcare industry and more broadly, society at large?
We know just from, there's dozens and dozens of research studies that have been done pre-NeuroFlow that show when you integrate mental health to physical health, you not only improve the physical health outcomes, but you reduce the total cost of care of that patient. So what we did at NeuroFlow was say, wow, those models are really great. Why isn't everyone doing this? And what we found was, well, it's really expensive, it's complicated, there's limited resources out there, there's limited therapists and psychiatrists. So using technology, which is what we've developed, we can help be a force multiplier. In that case, we could help these systems and these plans adopt these models that we know will drive better outcomes and reduce that cost of care. And what's exciting now is now we've been in business for 5 years, we have collaborated with our partners, with the health systems and the plans, and we're seeing that, we're seeing that data come true. We've reduced the emergency department utilization by 34% compared to a control group. Most of those patients, by the way, were not primary diagnosis of mental health issues. So it just speaks, again, that integration of care, which is so important. It wasn't just about the money when it came to SEMCAP, and you brought a tremendous amount of expertise and the perspective that was just luckily aligned with where we were. Your advisory board has paid in spades in terms of its value to us, with Ralph Molaro, the chairman of SEMCAP, who's the former CEO of Penn Med. His mentorship has been invaluable. And so when we thought about the idea of bringing on growth capital to accelerate the work that we were already doing, but then doing so with a partner that could help, in a holistic 360 capacity, to me, it was a win-win. What stood out to me, and I remember when we were going through the process of getting to know each other, we really leaned in and questioned, you have a large advisory board in your website. A lot of people could just put pictures and names on a website. And we pushed on how involved they actually were. And what I can attest to today is not only are they invested in the success of SEMCAP and their portfolio companies, they want to help. They're leaning in, they're reaching out, they're offering their network for connections. We've had a number of hour-long conversations with these people that, you could pay a lot of money to get meetings with them, or it could take a year to get on their calendar, and they're available at a moment's notice. We've been partnered now officially for a few months, and that's already paying off now. I think that speaks for the SEMCAP value proposition, but then as an operator and as the entrepreneur, can't place a value on that.
Well, it's been great to see him lean in, and I want to thank you for your time here today. It's a partnership that's rewarding for all of us. It's an honor for us to be a part of your team. We're inspired by what you and your team are doing, and I think the emotional connection that you and your colleagues have to NeuroFlow's mission is something that really stands out to us, and we're here to work with you to create a better mental health care delivery system in the U.S. as we go forward.
Thanks, Mark.
Thank you.
Appreciate it.